Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And, even though we're a little early, but we want to talk about back-to-school physicals. And why do we want to talk about back-to-school physicals? Well, I think that we ought to start paying a little more attention, not only with this show, but a lot of different shows in healthcare, and talking about what we have to do to take care of our kids, otherwise known as youth. And that grows all the way from pre-K all the way up through the high school units. So we're going to talk a bit about back-to-school physicals. And let me first introduce Dr. Sultana Alkon, who is a pediatrician with Broward Health Systems. Welcome.
Thank you for having me.
Good to have you. And Dr. Casey Wilson, who is a doctor of physical therapy, and she's with Broward Health North, which is up on Sample Road and I-95. Yes. That's a good spot to be. Talk to me about just general pediatric care today relative to moms and dads who, other than birthing a child and having a child being cared for over the first few months of their lives, what is usually the characteristics of you talking to the families and having them come back to see their child? How often do you expect to see their child?
Well, in well checkups, the frequency depends on the age of the child. Within the first 2 years, we see kids very frequently, from the newborn to complete vaccination schedule and to do a neurodevelopmental assessment. We see them quite often, on average every 2 to 3 months. Subsequently, after age of 3, the visits to physician for well checkup when there is no problem, just to discuss the well-being of a child and get some anticipatory guidance in terms of the issue that might be prevented in some ways or looked at, is suggested to be done once a year. And every child from age 3 up should be seen by a pediatrician at least once a year for well visit exam, even if there are no issues. Majority of kids think that when they go to the doctor, it's just because there's a problem. So they will ask the parents, why are we going to the doctor? And the answer is very simple: to make sure that you're fine, to see how well you're growing, how well you're doing in school, and we'll talk to the doctor about any questions you might have. And that will be a good opportunity for parents to kind of connect with the child and ask, what is it that you want to ask your doctor? And it could be about how many hours of sleep should I have, or what is my bedtime? Or it could be something related to the time of the screen time that they constantly are restricted by the parents. It could be about any other issues. Majority of kids want to know how tall they're going to be, or when are they going to stop growing. I mean, they have a lot of questions, and I think that's a good time to discuss all of that.
You mentioned screen time. I just want to get a definition. Screen time is, laptops, computers, tablets, cell phones, whatever, correct? Is that what you're talking about?
It is true.
What television?
Our television, yeah, altogether it is a screen time. It obviously, with electronic being so prevalent in our life right now, like you mentioned, and also it's so involved in academic environment as well, it becomes more difficult to kind of put a set limits as what is that amount of time that the child should be allowed to use the electronics for. In general, American Academy of Pediatrics recommend no screen time for kids younger than 2 years of age, and limited time thereafter, preferably to less than 2 hours a day, but of course that does not include school time.
Casey, let's talk about physical therapy, because you get to see various elements of a child at various ages. You see them through, I would assume, many of the issues relative to development and birth-related disabilities come to you and your team.
Yes.
Let's talk a bit about that.
Physical therapy, we look at different realms of how the child is moving, how they're learning, so different developmental milestones. So like you said, they start very young, so there's certain reflexes that we look for that are normal and not normal. There's certain things they should be doing, such as rolling over at a very young age that we look for. And as they get more towards the school-aged years, we're making sure that they're running, hopping, things like that. Make sure they're right on track physically with their development.
So, Dr. Alkon, here we have this this wonderful mass of protoplasm that turns into this beautiful child. They end up in the hands of a pediatrician, and in some sense, a lot of children are handed over to venues and other individuals who are part of pre-K programs, nursing, what they call child care facilities. You're really the sentinel. You're really the person. The pediatrician is really the stop-and-go signs. I mean, you see things that parents and maybe the caregivers, namely the people who are in these units, who are well-meaning, but have no idea as to the issues relative to the potential development of this child. So let's go from there.
Well, as pediatricians, we obviously are there to assess development of a child and pick out very early signs that might be suggestive of a problem. The importance is that the earlier you intervene, the better is the outcome. It is, though, a very sensitive issue because a lot of times it's sensitive in the way that it's very important to bring it up gently to the parents. Because as a parent myself, we all want to make sure that our kids are well. So when there is some concern, there is obviously big anxiety associated with that, and at times worries and disappointment, and at times blame. So as pediatricians, we want to make sure that we have very good relationship with the parents. And if there are some signs of any delay or any problem in development, which is primarily taking place during physical exams during early age, we work together with the parents to identify them, to explain why we think that it's a concern, and to discuss appropriate intervention, referral, and workup. And that could involve a motor delay, in which case we refer them to physical therapy and occupational therapy. It could be gross motor delay with, moving of the arms and abilities of the big muscles to function, or gait, or it could be a very fine and subtle delay in the fine motor skills, which will show up much later during school years with handwriting or with other fine motor skills functions. But there is also a language development and a social interaction. So it's a very complex area. And a lot of it is obviously, it comes together, and one might affect the other area as well. So it's important to work together with physical therapy, occupational therapy, language therapists as well. And as pediatricians, we do referrals frequently to genetics and obviously behavioral pediatric specialists for our more thorough evaluation. But it is our role as general pediatricians to identify those problems earlier. And it's just one part of pediatrics, which is neurodevelopmental assessment, language assessment. But as the kid gets older and those problems tend to not be picked up later in life, the more important part becomes emotional development of a child and a social development of a child. And that's primarily where the physical, the time during physical examination and well visit takes place. It's when we talk about emotional well-being, about mental well-being, about what are the thoughts that the child is having, what are the emotions that the child is experiencing. Is it a lot of anger or a lot of worries? Is it a lot of happiness or sadness? So those are important issues as well during physical examination, and that is the reason why American Academy of Pediatrics recommends depression screening questionnaires to be performed during physical exams on kids starting from age 11. And that is something that frequently parents might or might not pick up on, but definitely once a pediatrician spends a little bit of time with the family, especially noticing the dynamics of the conversation and the language, the emotions, I think they could pick up a lot of very important points and discuss that further with the families.
Thank you, Dr. Alkon. I appreciate that, because we're going to get to some of those items later on in the show. When we do what I would call traditional back-to-school physicals, you know, firstly, there are rules and requirements that are set forth by state standards in each school system that they must have X, Y, and Z.
Right. Well, traditional back-to-school physical, which usually happens when parents enroll kids in school, involves examination of the child for by a physician for any signs of illnesses, and that will be assessment of growth, height, and weight, evaluation of body mass index, and thereafter physician might make some recommendation as far as nutritional aspect of it, whether the caloric intake has to increase and the child is underweight, or whether the child is actually in the obese category, and we need to discuss diet further with limiting of sugar-containing beverages, watching portion size, eating healthy, exercising, and that's just the weight assessment. If there are any suggestive signs that the child might have an underlying illness contributing in the weight or height abnormalities, pediatrician might suggest some workup with blood work, or maybe seeing a specialist in some areas, as gastroenterology or endocrinology. And that is just weight and height assessment. Therefore, I mean, that's just the first step. Thereafter, we go into immunization schedule. We want to make sure that the child has had all immunizations. And as you know, immunizations protect kids from contagious diseases, which have been in the past contributing to unfavorable outcomes. Majority of kids nowadays are vaccinated, and parents are following American Academy of Pediatric recommendations for vaccinations. Kids who've been fully vaccinated before age of 2 prior to initiation of school will require a booster doses for certain vaccines. And that is the reason why it's important to have that physical. Obviously, during our physical, it's a head-to-toe physical. We talk about every part of the body. You know, we look at skin for any signs of any particular pathology. We listen to the heart for any abnormal murmurs. We feel the tummy for any enlargement of liver and spleen, and look at the body movements and see if there's any problem with the back. Kids frequently are identified of having scoliosis during preschool physicals. Especially as older they get, there is less of, I guess, exposed time where parents can observe their kids or feel their body. So it's very important to have a head-to-toe well done physical for preschool. And that is the importance of it. And we also talk about going back to school, how you feel about it. We want kids to be excited about new school year, and we stressed out that this is the opportunity to make new friends and learn new things about the science and the world, and just have a very positive attitude towards going back to school.
So, Casey, as a physical therapist, you end up often being the person who's referred to, or the child is referred to you with reference to some of these maybe physical abnormalities, inabilities to, you know, to have certain body movements or otherwise that might have been, not non-noticed by the parents, because they said, "Oh well, my son he doesn't throw a ball because he doesn't know how to throw a ball," or "My daughter doesn't know how to swim because she's afraid of the water." But a lot of times it's not that, correct?
Correct. To be seen by a physician, a doctor, they're trained professionals, so they'll pick up on subtle things that the mom and dad might not pick up on, or like you said, may make other excuses for. So they'll pick up on these things and they can refer to physical therapy, occupational therapy, even speech-language pathology. Like she said, we're an interdisciplinary team, so we approach the child together to address any deficits that they have. And we'll come up with interventions to help them. So we can do stretching, strengthening, we can work on walking, we can work on coordination, on balance, any problems that they're having to let them reach their maximum potential to return to school or sports safely.
Hearing test is a part of newborn hearing examination in the hospital at birth. Hearing test is also repeated throughout the school-age kids throughout the school years, at least 3 times. There's a specific recommendation again by American Academy of Pediatrics. And visual exams nowadays are quite comprehensive. They are no longer a chart far away from you, reading the shapes or, is it a dog or a cat? It's actually a very comprehensive exam which screens for astigmatism and any accommodation errors. And it's very easily performed. It's a handheld device. It looks just like an old-fashioned big camera. And the child is asked to look at the camera. There are some flying imaging or twitching that happens, and this is obviously a screening test, but it allows us to pick up kids who have problems with vision, and it's again a very important aspect of preparing for school.
But not to interrupt you, but that occurs in a pediatrician's office.
That's correct.
What I'm saying to you is that many, an overwhelming number of children that are in our school systems are not screened that way, all right? And because they may not get to the pediatrician because mom and dad may not have proper insurance. Mom and dad may be working, God bless them, 1, 2, or 3 jobs. They don't have time to get there. It's problematic, and we're destining, and again, I don't like to offer, but I am offering my comment, we're destining children to a life which is impaired because we don't know or we haven't prepared that child, which is easily done with the screening that you just mentioned. If we would allow pediatricians, optometrists, ophthalmologists to come into our school system and do this oversimplistic test and mandate it, then the child wouldn't necessarily be in the back of the room, be an agitator or otherwise, and I'm not saying that that's the only reason. I'm just saying, do you see what I'm saying? That it's important for us to realize that we can't put people, you can't expect, as a physical therapist, you can't expect a child who has scoliosis to be able to stand up straight and be a great basketball player because they just can't do it, right? Mm-hmm. So what you do is you work on it and you make that child more perfect, correct? Well, if we did the screenings in our school system, which I know it costs money, but why not save the child? That's my question. It's all yours.
Yes. Well, physical exams are very important. This is the time to make sure that all this is checked out. And we do screening for anemia, and that, again, it could be as simple as a finger prick in the office. The answer is right there. We're screening for any low hemoglobin. There are regulations and requirements that are there. We have facilities to do that, and we're hoping that every parent will see the importance of having once a year well visit. It doesn't matter if it's just before school or during school year, but typically why it happens before school year, it's related to sports activities. As we know that most kids right now are very active in different athletic programs, and there is requirements before school to complete the physical forms. We could combine a physical examination for well child as well as sports physical at the same visit if it's done by a physician. There are certain forms that we require parents to fill out, and it relates to family history of sudden death and maybe some disorders such as seizure or unexplained accidents. and clear kids for participation in sports. And we are very serious about that, especially in high school students when they participate in varsity games, to have a very thorough cardiovascular examination and, if needed, further investigations and referrals. Along this line, I want to just also mention that nowadays kids are frequently very busy with athletic participation, and pediatricians are aware that a lot of kids might suffer from some chronic musculoskeletal pain and complaints because of overuse of the body for athletic purposes, and that is again why physical therapy is very important for us. We work very closely with them for evaluation for sports-related injuries in kids. It's a very tender time because the growth is very rapid. The musculoskeletal system is changing and stretching, and overuse in some cases could contribute for some complaints that are necessary to be evaluated.
Casey, I'm sure you see a lot of that. Children who have growth plate, damage and things of that nature. Talk a bit.
So, like she said, overuse injuries are definitely very prevalent in the youth. A lot of kids are doing hours of activity a day in the same activity, and sometimes they're doing it 6-7 days a week and not really letting their bodies rest. We wouldn't recommend that for an adult, and we shouldn't recommend that for the children. It's good to catch these things early. So like Charlie may be having shoulder pain, he may not realize that it's really a pretty serious injury. So that's why doing these physicals, we can catch these things early and make the appropriate referrals. So again, we can teach them activity modifications, we can teach them how to do their activities safely without exacerbating that pain or that problem. A lot of times they need strengthening, or a lot of times they have laxity, so they can move more than they should, and that can open them up to problems. So we try to tone that down and make that under control.
And we're getting down to the last few minutes of the show, but I want to touch real fast on this. Screening for organized athletics in public schools or private schools is great, but remember how many of these children are out there in little leagues and again, community activity functions where the screening has to be mandated by the parents. We don't create any baseline information relative to concussive activity, which should be done. And again, this is just information that comes to me from people like yourself that have been sitting in these chairs. So I'm bringing that to the table, but I'm telling it to the viewers out there that if your child is going to be, active in, organized sports, you're going to need to get your child to a pediatrician as quickly as possible to have some of these screenings. We're down really to the bottom of this show, but I want to thank you both for your participation, particularly for your advocacy. I know how I could feel it. I could feel the advocacy coming out of Dr. Alkon, and I know the capabilities that you have, Casey, because the Broward Health North unit came to my mind. I talked before the show because of this Marguerite Stoneman Douglas thing. I mean, your center became the epicenter for care because of the trauma unit that's located right there. So I want to thank you on behalf of these people.
Thank you.
Thank you very much. And Dr. Alkon, thank you for your participation. We're glad to have you here. We're glad to have you as part of the Broward County team, not only Broward Health, but Broward County, because kids from all over the county come to see you one way or another. We don't know what the addresses are, but I'll guarantee you that they're from all over the county. And I want to thank both of you, because anyone that takes care of children, you're the blessed ones. So I wish you all both well. Thank you for both being here, Dr. Alkon, Casey Wilson. Do keep on doing what you need to do, and always know that Nova Southeastern University is here to help you. We are very, very focused on wellness, and therefore we're very interested in whether it be back to school physicals or whether it be daily, yearly checkups or whatever it might be. We were just talking prior to this show about the fact that people just don't take advantage of things, and they want to know later on in life, how come this happened to me? Well, it happened because, folks, you didn't take good care of yourself. You need to take good care of yourself. I always tell the viewers that they need to be participatory in their own care and in their loved one's care. So when a loved one brings a child into your office, they can't withhold the fact that the child, they can't swim, or they can't do this, or they can't do that. Tell your doctors. That's what they're trained to know these things. Remember, this show is your show. There's a telephone number and an address here that if you wish to get us on internet, let us know what you think about the show or otherwise, or if you have any ideas for another show, just let us know. And as I say to you, you got to take good care of yourself. And in order to take good care of yourself, you got to be communicative to the health professionals, whether it be a physical therapist, or whether it be a pediatrician or a cardiologist or whoever. You have to let them know what is really going on with you. Don't hide information. Thank you very much for showing up again this week. Remember, this show is your show. It's called Dateline Health. We come to you from Nova Southeastern University, and my name is Fred Lippman. Until next time, see you.